Well, let's talk to our friend Dr. Logan here with Partners in Primary Care. It's a new physician's operation. It's 4 places.
Yes, sir.
And it's primarily 65 plus folks, right?
Primarily the Medicare population.
All
That's
right.
right. That's where our focus is.
And Carmen's with us with Senior Action. We're going to ask her about exercising, but I'm finding out with medication sometimes people are losing balance. Is there some help for those folks?
Falls are one of the most common causes of injuries in folks as they age, and there are lots of different reasons that older adults might lose their balance and fall. Older adults tend to become more dependent on their vision for balance cues, and that's something your doctor can help you determine if that's the case. One of the other reasons that folks fall is because they are taking medications that might disturb their balance or equilibrium, right?
Interaction of meds too.
Right, interaction of meds, so sleeping medicines, medicines for anxiety, pain medications, blood pressure medications, those things can all cause you to have some balance troubles. But there are things you can do about that.
Oh, good.
So strength and flexibility are the key to good balance and the key to preventing falls. Also, if your doctor has recommended that you use an assistive device like a walker or a cane, you need to use the device.
She probably didn't recommend it just to be fun.
That's
Well,
right.
If you see someone, you can write the prescription yourself.
Right, absolutely.
At your place.
That's right. The assistive devices, people see those as a sign of disability, but what they are is to protect you.
Right.
Because you don't want to fall. Because tell two people, I mean, I know a lot of people know this, how dangerous it is for an older person when they fall, the recovery and everything.
That's
is a
right.
lot.
When a fall takes place, if it's a fall with injury, particularly if it involves a broken bone, it can lead to weeks of rehabilitation
Right.
and lots of other problems, and you don't want to have to go through that.
Well, Doc, can I call you Doc?
Of course.
May I call you Doc?
Of
I always
course.
wonder if doctors like being called
Yeah,
Doc. or
they
not.
did the school.
Well,
I answered all kinds of
do you
things,
really?
though, Jack.
3 times a day for a meal.
Yeah.
Well, Dr. Logan, tell me this. How many locations?
We've got 4 locations, one at Orchard Park, one in Greer off of Highway 29, one off of 153 in Powdersville, and then one in Anderson.
And Orchard Park is Greenville.
Yes, it is.
For those folks that are listening outside.
Now, one of the things that you were saying to help where we don't fall because of the balance is the lighting. If lighting
Right.
is a little bit low.
If lighting is low, then folks are more likely to fall. So at night, trying to get to the bathroom is a really common time for older adults to fall.
Right.
So should you keep lights on? Do you suggest that?
You need to
or-
have a lighted path to the
Lighted path,
bathroom.
okay.
So night lights that focus light on the floor
So you can
so that
keep
folks can see, that's a really good idea.
Okay. And then are there some exercises that you could do too to?
You know, we have Carmen with us from Senior Action. She's the wellness coordinator there. And one of the things that they provide at Senior Action that has been shown in research to decrease falls risk is a specific type of exercise called Tai Chi, which is really kind of cool. And we wondered if Carmen would maybe demonstrate a little bit of Tai Chi for us. And they have classes there, don't they, Carmen?
Yes, so we do have Tai Chi classes at Senior Action. Like Dr. Logan said, it's really good for balance.
Is it like a breathing type thing?
So it incorporates a lot of
Okay.
relaxation, breathing exercises, but it has a lot to do with shifting your weight side to side, but holding those poses a little
and that
longer.
would be good. So you, so
Well,
you
at
don't
this point, why don't we
fall.
mention the fact before you involve yourself with any exercise, get your doctor to approve it. Is that right?
Yes, you need to make sure it's safe.
Okay.
Yeah. Okay. So how do you? Show me how to do a little.
Sure.
touch.
So we'll start just by a little slight bend in your
Okay,
knee. So
slight bend.
feet should always be a little bit hip width apart, toes
Okay.
pointed straight. So that's always going to be your setup.
Okay.
And so you're gonna, like you said, Megan, we're going to take a deep breath in, palms are out. And now you're going to exhale, palms out. And from there, I want you to act like you have like a little ball of energy.
Okay.
So hold it, cradle it.
Little
And now we're all
ball.
going to shift this way.
Okay. Because you normally
The
have an
wrong way.
iPad in your hand when you have a ball.
Wrong
too,
way.
Exactly, right?
Yeah.
Now I want you to take your left foot and kind of bring it in so that knee is out
Oh,
towards me. Now you can
okay.
kind of feel that shift in weight towards the right side.
Yeah.
And now, all right, really slowly, I want you to lift that left foot up.
Jack, if you
This
go
could
Bring
be
it,
hard.
bring it towards me, and now we're shifting it over towards
out
the
of the way.
left.
If you go down, don't
Move-
take
move
me
out of the
down
way.
with you.
And so from there, we're actually going to do something called splitting the horse's mane. So
Do
you're
I
going
still
to
have
take
my ball in my hand?
Yes, you still
Okay.
have the ball.
Yeah,
Go ahead and
engineered
take
ball.
that top hand, slice it down, bottom hand slices up. And now you're parting that wild horse's mane. So really neat thing in Tai Chi, you have all these catchy names,
Yeah.
but it makes sense when you do it. And what we just did was shift our weight side to side
Yeah.
without falling.
That's
That's
really
awesome.
good because that's all stuff that you're going to do in a normal life when you're standing in
Yeah.
line for a little
Right.
while. You can do, so you don't get, they always say you lock your knees, and that's when people like pass out and stuff. So those
Well,
are
I'm
good.
sure you do other exercises
Oh yeah.
in class.
Yep, they're pretty much Tai Chi is a lot of forms. So that was one form.
Right.
You have a short form, which is 8 exercises, 24. So the list goes on and on. So as you build on to the fundamentals, when you see people maybe in the park and it looks like a neat little dance, those are
Yeah,
all forms.
they're all doing Tai Chi.
exactly.
How old are some of the folks that exercise with you?
Sure, our average age at Senior Action is about 75 to 80.
Wow.
Go, guys. Rock
All
it.
right.
There you go. So if
I'm
you're
impressed.
sitting, get up, do some stuff, especially during our commercial breaks is a great time.
Well, again,
do it.
Partners in Primary Care, 4 locations, new in town, lots
Yes,
of
sir.
doctors. How many staff members?
We have a total of 6 physicians, including me.
Okay.
Fantastic.
Well, I'd have to come to him.
You have to
not
come to
him.
him, obviously. Well, we're so excited you're
We've got
here.
great docs, though. All of them are fantastic.
Yes. Well, thank you
There
for
are the
being a part of our
locations.
show. There's the locations. Go to their website and find the one closest to you. Thank you for all your tips,
Thank
Carmen,
you.
too. These were
Thank
great.
you. We'll come back in a few minutes.
Yeah.
Stay with us.